You're watching Tililindo program on Cast TV.
Testai iger tetutietab tililindo en Kass TV amu kimnatet naet.
I think they're like they are standard screening methods. I already talked about screening for HPV infection. It is included, but it is not widely available. So we go back to the pap smear. And the pap smear as a strategy is where you try and using a very soft brush on the surface of the cervix, you pick some cells which are analyzed under a microscope to see whether they demonstrate any obvious changes which point to later development of cancer. We call that precancerous cells. Sometimes if you do not have the capacity to do that, there is a strategy we call visual inspection of the cervix. And the cervix will look differently if you paint it with iodine or if you paint it with acetic acid or vinegar, and then you look at it. If you are a trained eye, then you should be able to pick what is obviously wrong and what is normal. And these ones which are obviously abnormal, then you subject to the subsequent further testing. Yeah. So screening, those are the four modalities: HPV screening, visual inspection of the cervix under acetic acid and under iodine, and pap smear. But the gold standard in the screening for cervical cancer is the pap smear. In the last 1 decade, there has been development of what is called liquid pap smear. Yeah, remember I talked about using a brush. That means you have to use a speculum and look at the cervix. But now there is a liquid pap smear whereby you have a self-collection kitty given to you. Then you're able to introduce that particular swab up to a certain level, dip it back into the preservative, and then it is processed. So it is easy, it is self-administered, and also from the same specimen, the pathologists are able to even go further and test for HPV DNA infection as a complementary to assessing the cells which are scooped. Yeah, so that's a very innovative way of taking pap smear. It is not widely available. Of course, it costs a bit more money, but for people who are not ready for that kind of intrusion I talked about, have benefited from this liquid pap smear testing. I must mention that part of the reason why we insist, even if you're doing that once in a while, get somebody to check. There are other aspects of screening that the doctor will pick by looking at the cervix, which you are not able to pick if somebody collects the specimen themselves and bring. So in terms of the sampling, in terms of accuracy, and a few other considerations, that's why I say the gold standard is just the pap smear. Because of the level of the deaths and devastation, I think we need to educate women more about what they can do to prevent them from dying early. I have seen women who are 14 years with full-fledged cervical cancer because they got infected and they had all the other risk factors that I've itemized, which made them have accelerated development of the disease. So the narrative changes if somebody is sexually active, and particularly sexually active with multiple partners. And that brings us to the frequency of how it is supposed to be done. So you're supposed to do annual, after every 12 months, uninterruptedly for about 3 years. And the rationale is if you miss an abnormality in the first year, you will pick it in second year. If you miss in first and second, then you'll pick it in the third year. If you do 3 years getting normal report, it is assumed that you're okay. Yeah, because you have to take care of the sampling, errors in sampling, errors in reporting, errors in processing the specimen, and other mistakes that can happen. Now, after the third consecutive year, then you can space and do every 2 to 3 years. From the guidelines, after the age of 65, then it has not been shown to be very beneficial to screen women who are above 65 years. Yeah, unless selected cases. I think one thing I can laud the government is that they have brought these screening services very close. It is not a must that you go to a gynecologist or a doctor like myself. There are nurses who have been trained in the local dispensary to be able to either do visual inspection, or to actually take pap smear, which is transmitted to a higher level. Because a smear, once it is prepared, it can be carried to a higher level for evaluation. Secondly, there are quite a number of outreach programs which people go to the villages and far-flung areas to screen women. And therefore, my encouragement is let people take advantage of that and get checked. It is better to be checked than not to be checked. Yeah. In the cancer, there is something we call the case fatality, which means how many people will die when they are picked, when they are found to have the disease. And this is directly proportional to the stage of the disease. As I said earlier, women who are picked in the precancerous stages, they are treated and it is completely cured. Women who are found with a disease which is superficial and confined to the cervix, sometimes we do excision of that particular infected part of the cervix, and then you don't have to remove any other structure, especially if you have to preserve their reproductive capacity to get babies and have families. But women who come when the disease is already in the pelvic wall, it has affected the bladder, the rectum, or it has gone to the lymph nodes, then basically those are guys who are coming for palliative care, which is the terminal care of the disease. So it goes without saying that the earlier we pick the disease, the higher the chances that we can cure the disease. And cure means taking care of both the disease and the socioeconomic consequences of the disease. Because it is also a disease which can make you sell everything that you've had, and eventually somebody dies having spent all that money. Whereas this free screening service which is availed is just once in a year. I think it makes a lot of sense socially, economically, to have the screening. Now, HPV has a very high affinity to the cells in the cervical, the cells which line the cervix. We call them the epithelial cells of the cervix. So this virus has high affinity to attach there and integrate itself, affecting the DNA multiplication of the normal human cells of the cervix. It's like if a fire is burning somewhere, then you pour some paraffin. Of course, it flares up. So what happens when this HPV, human papilloma virus, integrates itself? It affects the controlled, predictable, organized multiplication of the cells of the cervix. and that is what is called atypia. Atypia means the cells are dividing in a manner that is not obeying biology. Yeah, from 2 to 4 to 8, 16, 32, 64. Yeah, so you find cells are just multiplying in a very uncontrolled manner, because essentially the cells should be, as new ones are formed, the old ones die off. So what happens when you have very many new forming and the old ones are not dying off? You have accumulation of those cells in the cervix to form a mass, or what you call a lesion, and that's essentially what cervical cancer is. So when you administer the virus, the vaccine, you are introducing some component to stimulate the body to produce antibodies, which will attack the virus in case you contract it naturally. It's the same principle that applies when you get vaccination for measles, vaccination for polio, vaccination for tetanus. Yeah, you are stimulating your body to produce a response which will be beneficial in future. So based on that, currently there are two vaccines in the market. One is can take care of the two most predominant strains, and another one can take care of 4. Yeah. So the word we use is divalent, then the other one is quadrivalent, depending on the company which is making them. And when it is administered and you produce antibodies, it means in the course of time, if you get in contact, other than the natural immunity that I talked about, the vaccine will complement that. Yeah, but it is given for people who have not had that infection, because it is assumed if you've had the infection, then you're already in the process of forming the antibodies. Yeah, the optimum age is 10. Yeah, some guidelines have pushed it up to around 21. Yeah, but this is I think this matter needs to be discussed with, for an individual. There is a screening which is applied to see who will benefit and who will not benefit. Because for a lady who is even older and they are not infected, then they may derive some benefit from the vaccination. You can have localized excision of the cancerous tissue if it is really confined to the cervix. In higher centers, they have what is called electrosurgical excision, where they use some loop and then they're able to scoop out the affected area. Sometimes you can use cryotherapy to dry out and kill those infected cells. Sometimes you can also, if you don't have those gadgets, like what happens in the rural areas, you can actually use a knife and excise the affected part. But when it is excised, it is taken for evaluation to make sure that you've removed the entire lesion without leaving the margins. Some diseases will require, and that is now when you want to preserve fertility, because you might find these precancerous stages in women who have not started giving birth and they have desire to get babies. Sometimes you may have to go and remove the cervix together with the uterus, which is called hysterectomy, total hysterectomy. And then as the disease spreads, if somebody presents at a later stages, then the uterus is removed, the cervix, the local lymph nodes and other tissues are also removed, and that is called radical hysterectomy, which means you are removing more than just the uterus and the tissues of the reproductive system. This is in advanced stages, and sometimes it is also combined with radiation to destroy any cells which may have spread to other places. The preference of getting babies is secondary to the stage of the disease. So if the disease is early, then you may opt what is called fertility preserving option. Whereas if they come and the disease is advanced, then it may not be an option to leave. Because if you remove part of the cancer and leave another part in the patient, in fact, it will even spread faster. So you give suggestions or recommendation based on the individual circumstances in terms of their age, the disease stage, and the preference of getting babies or not. Yes, because I'll just challenge you to look at the Cancer Act of 2011, which was hyped, and actually there was we're supposed to have an agency to coordinate that. There was supposed to be a registry, which has not really kicked off. So even from that programming level, you find there's a problem. Sometimes it makes it impossible to make decisions if you do not have the information or the data. But also, even in terms of deliberate budgeting for this kind of problem, despite the fact that we know that cancer of the cervix is killing more women, probably more than what the bandits are killing in those arid areas, because the bandits will attack and maybe kill 10, 15. The figures I gave you earlier means that on a typical day, actually now we count even every 1 hour, a certain number of women will die from cervical cancer. So there's deliberate need to deliberately plan and allocate money for screening, creating awareness, and even referring women who are found to have the disease early. Some of these programs we talk about are largely donor-driven. And you see, when donors pull out, or when it is not in tandem with their overall objective, then you find many women screened in the village. Some of them are found to be having malignant lesions, and then they are left there because it is not within the scope of what the donor is doing. Maybe the donor just wants information, the figures, but it is not in their interest to do follow-up. So it is a program that requires every person on board, the government actors, the non-government, the church, the media fraternity, and everyone who can raise this awareness. Otherwise, those are the challenges that I can pinpoint. Yeah. And people think people who get cancer of the cervix are being punished for their, promiscuity, which is a very wrong way of looking at it. I don't think God is specifically keen on punishing those and leave other people who have done even bigger transgressions. If you understand the risk factors, then you appreciate that any person can get the disease. The other myth we see, especially around cancer, there is a belief that it is associated with the evil spirits or a curse, so that if you did something to somebody who died and left a curse. So even when somebody is told you have a disease, you find they will rather spend time engaging in black magic instead of accessing care early. And that's why we find women coming to the hospital very late in the day. Okay? Then the other thing, of course, the myth is cancer is a painful condition, which is not true. As a matter of fact, even women we see in advanced stages of the disease, the only thing that brings them to the hospital is having bleeding. Every time they have intercourse, they bleed. or sometimes producing very foul-smelling discharge because of those tissues which are dying and decaying. They have a stench, a characteristic stench. That's what will bring them. It's not painful. So you don't have to have pain for you to be checked. Yeah. And then there's also the feeling I said earlier about the disease is associated with the poor. We have had many people. In fact, we had one media personality who passed on sometimes last year from the very same disease. Probably they did not go for screening early, or they may have gone for screening, but it was missed. Yeah, we never know. So that myth also needs to be demystified, because it does not select. Yeah, I think those are the few myths. And then of course the religious angle, which I talked about. Yeah, it is not, sometimes we bring the aspect of the devil too soon, even when the devil is not involved. Yeah, so it's good to raise awareness, let people decide, let people know that any person can get the disease, but now if they are screened, there is help. I think one of it is what we are doing now, creating awareness, because there's even a scripture which says people perish because they lack knowledge. And when you know the truth will set you free. So the moment people are aware that they may hesitate because of other reasons, maybe they don't have money or maybe fear, but that bit of even people declaring that so and so has died from cervical cancer, which is preventable, then it's one strategy. The other strategy is to have champions. People will come out and campaign, and we've had campaigns even for conditions like HIV, which really did very well when people thought that HIV was evil spirit and people are dying in numbers. So getting champions. Number 3 is having deliberate budgeting, because for you to tackle this public health issue like cancer, you need a budget which is sufficient to buy the testing kits, to facilitate people to educate, to print education materials, and also to finance passing around these messages so that people in the far-flung areas are reached. Yeah, and then also create a very well laid out referral structure, so that if somebody is picked in, say, a village in Kimende, for example, they are not left in the village. There's a way of escalating this person and processing them up to the point when they are completely treated. Yeah. Then the last one is what is called contact tracing. It's been shown that men whose wives die from cervical cancer can still harbor these oncogenic strains of HPV. Yeah. So that's one of the things we don't look at mostly, because if this person marries again and they have not been treated and they harbor that, then it is possible that the other wife they marry can actually develop the same thing. Yeah, it's a passage of time, but it's a contentious thing. But those are some of the things we are now trying to piece together. Why somebody's spouses are dying, or sometimes even spreading to other people. So it is always good to look at it from the public health angle, so that you have a bigger impact in comparison to just focusing on one individual patient. Yeah. We had earlier about vaccination of prepubertal boys, which is key. Currently, there's no medication that is available to treat this HPV among the men. And that's why every time we discuss about cervical cancer, the take-home message simply comes back to screening on women. Because women are anatomically and structurally disadvantaged, they have a place where these viruses can hide. Men largely will not have that surface area for, and the same thing applies to other conditions. So we are not in a position where we can recommend any other bit other than just screening. Yeah. So if you want to gift somebody, you want to gift a friend of yours who is a lady, instead of buying them a dress, just take them to the nearest place, get them screened, and they'll thank you later.
Especially now with Valentine's coming. That'd be a good gift.
Yeah, that's nice.
Yeah.
Instead of buying them unga, and even for the politicians, instead of buying them unga, just carry them and have them screened. Yeah. You will minimize how many people will call you for a funeral later, or people calling you for donations to take their loved ones for, let's say, radiotherapy or sometimes other complex treatment because the disease has spread. Yeah, because it's very predictable. I think one is to develop a bigger bargaining power in terms of sex and sexuality and matters of reproduction. By that I mean that women can actually demand to be facilitated to go for this screening. Yeah, because we've said screening is not expensive. Sometimes it's actually offered for free in government facilities, but they need some fare or transport to move from their homes to the dispensary. And if they are not facilitated, it's very difficult. Sometimes they actually denied that permission to go. So when we give them a bigger bargaining power in issues about their reproduction, trust me, all the women will come for screening. But if they are robbed that, then it means they have to seek approval or go through an intermediary. Then it is a problem, because now they will go for screening when the other parties want, their spouses. If the spouses do not want, they will not come, and that's a big challenge. Yeah. So that empowerment, the social empowerment of women, is very cardinal in if we are to make any steps in taking care of the disease. So there are programs under the Ministry of Health which take care of this. I told you earlier there has been an attempt to actualize the Cancer Institute and the programs around that. I'm aware that NASCOP, because of the early association I mentioned between cancer and HIV, NASCOP is also involved in screening. There are some partners which also give screening from time to time, likes of Cambry and other development partners. And even county governments. I'm aware that county governments, especially under the first ladies of these counties, some of them have taken up to popularize this message on screening. My take-home message for this particular month is cervical cancer screening saves life. Yeah, and that is a fact. Number two, the test to go for is pap smear, and pap smear is not painful. So I would encourage ladies who are eligible to show up and get screened. Men who have ladies who are eligible, encourage them to come and get screened, because that way you minimize spending much more money later on Yeah.
the city?
So currently we are based at KMA Center, Kenya Medical Association in Upper Hill. We are on the 7th floor under Calgary Healthcare Limited. Presently, we are not running outreach activities, but we offer the screening services and general consultations, especially around this very important reproductive health topic, which is cervical cancer. I think cancer is a very personal disease. Then cancer is a very distant disease if it is not affecting you or your next of kin. Every day I meet women and caregivers who have exhausted everything. They have sold everything. They have even sold the very property they had to try and salvage. So cancer is a personal disease and a very distant disease and very devastating sometimes. So my main message, let people go out, get checked. Let all players, especially the government, come out and educate the masses and facilitate the screening. It is easier to screen and treat early than not treat at all. So that is my take-home message.